Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo, and I'm here with my boot-wearing, rodeo-kicking co-host, Dr. Jay Calvert. How are you?
I'm good. I do have on my boots.
You have on your boots.
I have to. I'm going to go see Dwight Yoakam tonight at the Greek, and it's going to be awesome.
It's going to be amazing. But before we can get you there, we do have to do these podcasts because we have some really exciting things to talk about today.
We do. There's a lot of things going on, and I know that you had an amazing trip to Costa Rica, and that is what we are talking about, is what you learned at the Motiva Headquarters in Costa Rica.
Yes. So we have done a whole Motiva podcast way back in, probably November or October of last year, right when they first had their FDA approval announcement and they were available on the U.S. market. So these are a brand new implant company, and they have just sort of taken the breast implant world by storm in certain regards because what they have to offer is really unique compared to what has been out there previously. And the other companies that are out there that offer breast implants are still great companies. Motiva just sort of put a different spin on how they created these implants, and it shows in their clinical data. So one of the things all of us like about it is that they have these really low rupture and capsular contracture rates. And
that's right.
It's crazy low. And the data has held in both the U.S. trials and in the European trials, which were much longer. So it's real data.
Yeah, I mean, like I've said on the earlier podcast, I've put these in Dubai. They were available internationally for the last 14 years. And then they just went through the FDA process and got them on the market here in the U.S. So they've been around. So it's not really it's new to the U.S., but not a new company. Right. And the implants are great. The data is great. And, I've put in a bunch of them since they've been available, and they're awesome.
And they're awesome. And so I had a chance to go down to Costa Rica, which is where the company's headquartered. It's where the founders and the owners of the company live and where they have their production plant and where they're really based out of. And let me tell you, it's a publicly traded company, but it's also very much a family business. Like when we were there, we had presentations by the owner. And then we went to the owner's house and his wife cooked dinner for us. Like it was still like the kids were running around and like saying, boo, jumping out behind couches and like scaring us. Like it was very much a family-oriented business, even though it is a huge business. So there's just so many unique things about this company. And we're not going to delve into all of the things that we talked about and went through the process of, because there's one thing in particular that I want to hone in on today, and that is this technique called Preservé. And Preservé is not available quite yet in America. It's available in European and Latin American countries. But right now there are just a few surgeons here in the U.S. that are sort of doing them on a trial basis, but they are not widely available to all of the U.S. surgeons. But because there is already a social media buzz about it, we are already fielding questions about what exactly is Preservé.
And I've had many of my patients who already have breast implants say, like, should I do this Preservé thing? I was like, I think that ship has sailed a little bit. You have breast implants in already. And what Preservé is, and you'll tell us about it since you probably saw the technique, learned it. And are you one of the people now that can do it?
I am not. So I'm still waiting for it to be, mass available here in the States.
So what I understand it to be is it is a technique to perform breast augmentation with a device that is designed to make the pocket for you to place the implant in. And it is very sort of gentle on the tissues, was sort of the claim. And it makes the operation easy, can be done under local anesthesia. It's a subglandular placement, I would guess.
Yeah, it's subglandular. So
that means instead of going under the muscle or under the fascia, it's just straight under the gland.
Correct. And you're correct. All of those statements are correct. And one of the interesting things that I'm sure you've noticed also using Motiva is for a long period of time here in the United States, a lot of us were not putting implants in subglandular or even under the muscle fascia. We were putting them subpectoral under the pectoralis muscle, because the data that we had and the implants we had at the time said that that placement had decreased capsular contracture rates, which was true at the time for the implants that we had. These Motiva implants are routinely placed above the muscle, either in a subfascial or subglandular plane, which historically had higher capsular contracture rates, but their data and their implants just don't have that problem. So a lot of us feel way more comfortable putting these Motiva implants in that subglandular and subfascial space because that capsular contracture rate is so low. And capsular contracture, for the uninitiated, is when you have a hardening of the scar tissue or the capsule that forms around the implant. Everybody gets a capsule, but usually it's very thin. You don't even know it's there. In capsular contracture, it gets thick and hard. So yes, that's a little background into why we're putting them in this subglandular space, which was previously kind of an off-limits space for a lot of us. And the whole concept behind Preservé is kind of in the name. The idea that you are preserving the natural anatomy of the breast. And it is true that to some extent, if you're putting in an implant in any position, whether it's under the muscle or over the muscle, you are going to disrupt some of the natural ligaments of the breast, because there are ligaments that attach the breast tissue to the muscles down to the chest. You have to get an implant in there.
You're going to make a pocket.
Got to make a pocket, which is not a natural space or plane. Some of these ligaments are going to be disrupted, particularly if you are trying to pretty dramatically change or enhance the shape or size of the breast. Because as they describe in this Preservé technique, there are these ligaments that are, we learn in medical school about Cooper's ligaments, which are these suspensory ligaments of the breast that sort of keep the breast tissue intact and in place. These are different ligaments. These are called circummammary ligaments, and they actually form a circle around the breast, and they go around the periphery of the breast. And you can see them, and you can, when you're doing your dissections, you can see them, they're cutting through like really thick, strong bands of tissue. And if you're trying to get a larger implant in, particularly if you're trying to get cleavage in the center of the chest, you have to come through these bands, because these bands are usually, a couple of centimeters off of the midline. And if you're trying to get an implant to sit closer to the midline, you have to come through these bands. There's no other way to create this shape, because let's face it, you're putting an implant in, it's an artificial device, and you're creating an artificial appearance, no matter how soft and natural we try and make it.
Right.
So
they want to look natural-looking breasts, right?
Which means you can't always preserve your natural God-given anatomy. That's kind of counterintuitive to like what we're trying to achieve here. Except in the case of Preservé. Preservé says, well, how about we don't disrupt all of those ligaments and just preserve what nature and God has given you, and maybe just enhance it a little. So the concept is that none of those ligaments that are on the periphery of the breast are disrupted. And the key to this technique is they use an insertion device. So you can make a tiny little incision, and through that incision, you insert this device that has a balloon on the end of it. You put it exactly where you want your implant to sit. And this is a very scientific procedure in the sense that they measure the exact implant they want, they measure the width of the patient's chest wall, and they place that implant and that device centrally in the center of the breast so that they know they're not going to disrupt any of these ligaments on the edges. And then once that small device is inserted, they can pump up the balloon, and the balloon does the dissection very gently and creates the space. And more importantly, it doesn't disrupt those ligaments because there's no sharp dissection.
Right, and the plane in between the pectoralis fascia and the gland is a bloodless plane.
Yeah, it's
so
a
there's not
potential
going to be
space.
there's not going to be any bleeding with this kind
It's
of move.
not at all. That plane separates very
right
easily. Yeah. So once you have it in the right space, you blow up the balloon, and now your pocket's created for you. Then you can pull that balloon device out and then very easily insert an implant. And so the benefits of this technique are because it is usually done in such a small incision in this really kind of gentle way, you can do it under local anesthesia. Some people prefer to still have their patients go to sleep, but we saw a case when we were in Costa Rica that they did for us, and the patient was totally awake and waving and talking to us on the OR table, and she just had a little bit, I don't even know if they gave her sedation. They might have given her a little bit.
Yeah, I mean, for subglandular augmentation, you can do that under local anesthesia for anyone. I mean, we did in my resident clinic in Pittsburgh, we did a lot of those augmentations whichever approach we used under like local with very light sedation, and by light sedation I mean they took 2 Percocets and a Valium, and that was it. And you can get it done that way if you're doing subglandular. If you're going under the muscle, it's a little different.
Right.
So,
but also too, like if you're sitting, like I tend to sit my patients up a couple times during surgery just to look and make sure I like where the implant is sitting, that it's the right size. It can get a little funky if you're doing that back and forth with an awake patient, with the airway and the breathing and all that stuff. So it's not something that is traditionally done completely awake. But in this case, there's no like going back and forth with the size. You choose the size ahead of time and you just pretty much put
that's that.
And that's that.
Ooh.
Because the size is based
really don't like
on the
that.
patient's anatomy.
Right.
It's based on their base width and more or less like what size-ish they would like to be, but there's not a whole lot of wiggle room. So your base anatomy and your base width, that's what we're preserving. That's the whole concept. We're not changing it dramatically. So you don't have the ability to make big changes in size. You're kind of trying to preserve the structures, and if you do an implant that's too big, then it doesn't really work. So the implants that we saw being put in Costa Rica were very small. I think we saw like a 140 and a 190. Aww. They were so cute. They're like little silver dollar pancakes.
Yeah, it's like a little pancake.
Yeah. Like,
why bother? But okay. But some people want that now.
It was really cute. And so
that ballerina breast dog is like come into vogue right now.
Yeah. Ballerina boobs, the Pilates breasts I did today. Like it's very much a look that some patients really do want. And I think that when they get to the United States, they're not quite up to the full size range yet, but I think at some point they might be getting up to like low 300 cc's maybe for these implants. But again, the idea is to preserve the natural structures of the breast. So we're not going for a full middle cleavage here. You're getting a larger implant, but they're keeping it kind of off the center of the chest, because they're trying to preserve those ligaments. And the idea being that if you preserve the ligaments, the results will last, and the breast is supporting the implant, not skin alone per se. So that's one of the techniques. And it is interesting to know, because if you've ever seen subglandular breast augmentations from back in the 80s or 90s when they were a little more prevalent, they do tend to fall and be a little more saggier and a little more natural looking, because a lot of the support is gone, and it really is the skin that's supporting these implants. And so the idea is that even though you're putting it in the subglandular plane with the Preservé technique, because you're preserving these ligaments, the ligaments are supporting the breast implants, and you're not going to have that classic sort of falling down subglandular implant look.
Well, and also they're smaller
And also they're smaller implants. They're just not going to fall that much. A 140 cc implant really doesn't have far to go.
So there was a plastic surgeon named Barbara Hayden, and she wouldn't put in anything bigger than 300 cc's. You wanted something bigger than 300, you got to go to somebody else.
Yeah.
And she said it just avoids problems.
That's not wrong.
Big implants, big problems.
Big implants, big problems.
That's sort of my territory. So I don't know how many Preservé I'm going to be doing, but
it's for a very unique subset of patients, and it's for patients. Maybe they're in good shape and they have, they're pretty thin, or they're in good, fitness, and they've had maybe a couple babies. And so they have just some loose skin that they just want to fill in. They don't necessarily be bigger than they are, but they want to just fill in that top part of their breast that have become deflated. And they would otherwise never have really even considered having a breast augmentation. They don't really have the time to go and have a whole surgery and take off a week from surgery. So this is for that patient that maybe otherwise would never have even considered having a breast augmentation. This is like breast augmentation light.
Nice. I like that.
Yeah. So they get, minimal downtime, easy recovery, and they're not really dramatically changing the appearance of their breast size-wise.
Yeah, but the 300 cc's or less, can't remember putting in a 300 cc implant. I'm sure I have.
I'm sure you have,
Doctor. Sure I have. But the last ones were 625, and 475.
So you will not be doing Preservé.
Preservé might be hard for me.
Yes.
Tomorrow I'm doing like a 300 to 350. So
okay.
I guess that could be one, but that's okay. Well, we'll see when it gets here. I think it's great. I think it's anything that it sounds like they're actually opening up breast augmentation to some people that may not have considered it.
Correct.
And that's why I think it's great. And I think that people are thinking about the operation and trying to do it, in a safe manner with less complications. And so, kudos to, the Motiva people or whoever invented this device.
Motiva, it's a Motiva product designed for Motiva implants.
Yeah, somebody, was thinking it through, and it's good.
They do. And that's sort of the whole ethos of this company. I think there are a lot of companies that can say a lot of really nice words. We believe in women and we're all about this and that. But this company is actually about women. Like, I don't feel like it's, just them trying to get a PR spin on what they're saying. From top to bottom, they're like, we built this company for women to make them feel better, to empower them, to keep them healthy. Like, they put so much thought and science, and everything they do has meaning behind it. It's not just, obviously there's a need to make money, but it's also like,
sure,
how can we do this in a way that really is in the most responsible way? And you come there from America, and it's just it's embarrassing because like everything they do is like so environmentally conscious. I mean, they're in Costa Rica. They have a huge jungle and climate that they have to take care of and protect. But their entire building and complex, this giant factory that they have built, is like 0% waste, carbon neutral, like solar panels. Like, everything is just like, let's literally preserve what we have and take care of it, and it's guardians and stewards. And it's just such a thoughtful company that's
great.
I was really impressed by it.
Well, I've been working on my carbon footprint. So, that's good.
It's important.
It is important. You got to think about that. And it is. And, obviously that really, that's just an added bonus when you think about it. I mean, I really like the Motiva implants, and to hear that sort of commentary on how they're doing business is great. And, we don't have any financial interest in Motiva, although I probably should buy some stock at this point. But I don't own any now. And so, I think that's great that, the Preservé should make it here, but I'm just going to keep putting the Motiva implants in the way that I do it.
Yeah, and it's I think like you mentioned earlier, if you've already had a breast augmentation, this is not going to be the technique for you, because whatever ligaments you probably had to preserve are probably not preserved anymore. And by the way, that's okay.
Listen, my patients, they come to me, they're like, I want cleavage. If I don't get cleavage out of this, I'm going to be upset. Yeah. And so, those
and
ligaments
the average person isn't walking around with cleavage unless they have big double D breasts at baseline. Like, to get cleavage, you kind of have to do something that's unanatomic to that person. So it is a technique for a specific patient looking for a specific look, but I would not say that it is across the board a technique that will be adopted for the average person who's looking for some kind of larger augmentation.
Don't worry. I'm talking to my patients now. Don't worry, everyone. I'm still going to put in big implants. I got you. I'm here for you.
Yeah. So I think that's it. Oh, I do have one more fun tidbit that I brought back from Costa Rica. I love this one. So when you have a Motiva implant and you're in the OR, the implants for all implant companies come in boxes. Each implant comes in its own little box. And you open the box and you give the implant to the surgeon and they put it in the patient. So the Motiva boxes, they're purple or they're whatever color. You open the box up, and the inside is this beautiful artwork. The entire inside of the box, like right now, the styles change, but right now it's kind of like this jungly print. Sometimes it's flowers. And you open it up and everyone goes, oh my gosh, it's so pretty. Like, it's this beautiful presentation that no one's going to see. It's just the box that the implant comes in, but it's so beautiful. And I always just thought, well, that's just classic Motiva. They put a little emphasis on all the small things. Like, details really matter to this company. But what I found out was that the owner's wife used to be an OR nurse. She was a circulating nurse in the OR, and she came up with this idea as a way to bring joy to the OR staff, because the OR staff is stressed out and they're running around, they have other things, and to have this beautiful box that they can open and see and bring a smile to their face, that's why they did it that way.
And it does.
And it does. Every
time you
single
open
time
it,
someone
opens
one
so
goes,
cool.
The nurse opens it and she goes, oh my God.
It totally works.
It brings joy.
That's right. So that's awesome.
So just little small things like that is why it's a pretty awesome company.
Well, my patients are loving the Motivas. I can tell you that. Yeah. They can be seen on my Instagram whenever you like, and I really think they're amazing. So, kudos to Motiva. We'll look forward to the arrival of Preservé, and I'm sure you'll be doing some of those.
I'm sure.
And
I think that's pretty much it. Yeah. So that's pretty much all we have to say today. We have to get Dr. Calvert to his concert. Without any further ado, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.